Good afternoon, everybody, and welcome to our daily COVID meeting. Today is Wednesday, the 15th of July. We're glad you could join us. We're going to start today by going to the board and taking a look at some of the trends here in Florida before we delve into what's happening here at the community specifically. This first graph that we wanted to take a look at today was the cumulative case by daily. So what that means is it's the number of cases that are new on any given day since the start of the pandemic. So you can see that we started tracking this here in Florida back on March the 6th. We started our precautions on the 18th of March. So we've been at this we started our precautionary measures way back on March 18th. So you can see we've been at this for a good 3 months. The first thing I wanted to point out was this green line. So here's the first thing I'd like to point out. You can see that we started our precautions back here. It steadily rose. They thought we had broken the curve. You can see the arc of the curve. Things started to come down. The governor released restrictions on May 1st. That's this first green line. Things were pretty stable for the next 15 days. On May 15th, you'll remember he broke phase 1 into 2 phases, an early stage and a later stage. On the 15th, he got comfortable. You can see this second green line. That's when he opened it up to the second phase of phase 1. Things continued to be very stable. You can see right up here until the 27th of May, things were actually continuing to decline, slight decline. He made the decision on June 1st to open it up to phase 2. And when he opened it up to phase 2, you can see there has been a steady decline throughout the entire month of June. We saw growth, and then on July 1st, there has been a dramatic increase in new cases, and these last 3 or 4 days, you can see that we've been averaging 1,500 new cases per day, and that's actual cases as opposed to the cumulative cases, which is people who are testing and those results are being put into the system. So if you look at a 7-day average, and that's usually what we're tracking, this number that's where we're seeing these numbers of 12 and 15,000. So this is the 3-day track on the entire United States, and you can see it's sort of laid out in a U.S. map. It shows the number of new cases in a 3-day cumulative period. And anywhere you see these light cases, things are pretty stable. They become lighter pink, maybe a little blue. That's the next step up. And then you start into the oranges. And here you have a light orange in Louisiana, a little darker orange in Alabama. And then the one state in the union that is bright red is Florida. So one of the things that was interesting about the outbreak here in Florida, if you were to treat Florida as its own country and compare where Florida as a country ranked in the world in terms of the number of new cases, last week Florida would have been the 3rd highest number of new cases countries in the entire world. This is a chart that is looking at the worldwide mortality rates in terms of the number of deaths and the percentage of individuals who are impacted or affected by COVID, and how many of those have actually expired. And so it is very nerve-wracking when you look at what's happening here in the United States in terms of the number of confirmed cases. It's spreading faster in the United States than anywhere else in the world. And that has been true for, nearly 60 days. But here is the positive side of the other side of the coin, a little more positive. If you look at the number of deaths in a percentage, the United Kingdom, Mexico, Iran, Egypt, Indonesia, Guatemala, Iraq, the United States is pretty far down the list. We're at about a 4% mortality rate. And there are a couple of reasons for that. One is we are so low that we have never overwhelmed our hospital and healthcare capacity, which means that if you do acquire COVID and you go to the hospital, one, they'll be able to take care of you, and secondly, they have the resources, the personnel, and most importantly, the beds to accommodate those individuals who are afflicted with COVID. So that has helped to keep that number low. The other thing that is working really well for us is in a modern country with running water and electricity and consistent services and healthcare and good travel and access. The folks here in the United States have better access to technology, and they can get at it in a quicker period of time. And so it's not like in a third world country where you may have an illness and not be seen for weeks, or in a socialist country where their systems have become overrun. So with good health care, quick early detection, we have been able to keep this number at a much lower rate. Okay, here is the Florida COVID information from the Florida Department of Health. And there are three things here that I'd like to look at and be sure to point out. And so the first is this data here on the left side is the total number of cases, but more importantly, of the 301,000, there have only been 19,000 hospitalizations. Here in Pinellas County, we've had 999 of those hospitalizations. So less than 1,000 of the total number. So that's, again, important because where we will lose control in a broader sense is when we lose our acute care hospital, our emergency response teams, our ER clinics. As long as we have capacity in our hospitals, we will be able to fight this and effectively control it. The other trend that I want you to see, and this is we look at the difference in these two charts every single day. This top chart is the number of new cases, and you can see ever since 6/1 there has been a steady increase. There are days, 3-day periods where the numbers look a little better, look a little worse, but it is consistently increasing. I want you to compare that with the same thing that is happening with the number of deaths. If we just lay the pencil here, you can see that the number of deaths is slowly, steadily declining. So as more people are sick and infected and diagnosed, the greater the exposure becomes, but we also can see that the herd inoculation is beginning to have some effect because the number of people who are well and recovering and not dying from the disease, that is beginning to drop off. So you can see the first 3 months of the process, the curve is headed up. The last 3 months of the process, the curve is beginning to head down. So you can very clearly see the breaking of the curve in terms of fatalities, even though we're not seeing that in the number of new cases. So let's take a look at the numbers here at Regency Oaks and see where we are. The number of individuals on quarantine, we're currently 13 in the independent living. There are 2 new residents that were added to the quarantine list, both of them not related to COVID but to a hospitalization stay. There are 9 over in the skilled nursing that are in quarantine and 0 that are in the assisted living. And with our staff, we currently have 11 staff members that we have on quarantine in the IL, 8 in the skilled nursing, and 1 in the assisted living. So here's another piece of good news. Both of these 2 categories have been down for 3 consecutive days, so we think that those trend lines are showing positive. In terms of actual individuals that we are tracking with either flu-like symptoms or COVID-like symptoms, in our residents we have 3 here in the IL. That's up 1 overnight, and we are testing that resident. There are none in the assisted living or the skilled nursing. You'll recall in the previous weeks we had been tracking the assisted living and skilled nursing because we had a suspected outbreak. All of those tests have come back negative, and the community is currently free of any COVID illness, and there are no suspected cases. That's really good news. In terms of our associates, there are 8 in the IL, 4 in the skilled nursing that we are testing because of either flu-like or COVID-like symptoms. In terms of our actual number of residents and associates who have been diagnosed as COVID positive, we continue with 2 residents. One was from the AL and the other here in independent living, and there are 12 associates that are 11 of which are on quarantine and 1 of which will be coming off quarantine and getting ready to return to work. One other figure that I think is important to look at, and it's the number of negative tests. We have now had 128 residents test negative for COVID and 253 associates test negative. So when you think about that in terms of a larger, broader picture, 253 of the 350 associates have tested negative. We are beginning to overwhelm the curve. And then with our residents, it's 128. There are currently a little more than 500 residents on our campus. So 128 of them have tested negative. And those numbers continue to rise, which is the positive bit of news that we're looking for in this. Okay, so that concludes the numbers portion of our broadcast today, and we thought it might be fun to go out and do man on the street interviews with residents and staff. So why don't you come along and join us? So we're in the office of Lauren Rose, our Director of Administrative Services, who had the misfortune of being closest to my office. And so, Lauren, we're going out and we're asking people, this is our man on the street interviews. We're asking people to share a positive COVID experience with us.
Okay. Many weeks ago, I had shared with everybody that my family lived in New York, and I was glad that everyone was safe. And then a couple of weeks later, I reported that everyone had contracted COVID. And the good news is that everyone had minimal symptoms. As a matter of fact, my brother was asymptomatic and didn't even realize he had it until he got tested. And now everybody is healthy and fine and can't wait to get out of their houses.
There are a group of us who gather together in the afternoon. We have cocktails or wine. We sit around and just reminisce and talk and laugh at silly things. And it's wonderful to have that socializing every afternoon. And we really look forward to being outside, enjoying the wonderful breeze and the shade and the company. And the company is really important.
See all those notices they have canceling all my favorite meetings, and it kind of disappoints me because I work rather closely with Ricky in the food service, and I haven't seen him since the parade stopped 2 weeks ago. And I guess I should just get up and go visit some of the people and see how things are going. And I think most of the people are happy, looking forward to the well-prepared food we're getting delivered to our rooms. I think that's very important.
Hello. COVID-19 has given me the opportunity to continue to bring in our wonderful staff members every week. Welcome to the team.
19 has given me more opportunities to spend more time with my family.
Well, that was sort of a fun way to take a different look at this virus. You know, it's so easy to get wrapped up in the numbers and the negativity, and it's important that we remember that life goes on and that we're all struggling to do a great job and deal with the circumstances. It's difficult sometimes, but being able to find the positive silver lining in the cloud is really important. I hope you have a great day, and we'll see you again on Friday at our forum.